Greetings. This is the second recording related to the nervous system. This recording is going to focus on terminology and pathological condition relating to the nervous system. As a best practice, I recommend going through the terminology and combining forms found on page 357 to 362 in the textbook. There's a lot of combining forms for this system, and it's one of those systems that require a lot of reading and repetition. So I recommend you go through those exercises because a lot of the combining forms you may only have seen once, even in medical terminology. This screencast is going to focus on the pathological conditions that we see on page 362 to 371. So I'm going to use, based on our description of the pathological conditions, looking at some of the diagrams from the textbook. If you're with me, you're on page 363 in the textbook, and this is a pathological condition that affects the nervous system called spina bifida. There's 3 different kinds of spina bifida, but what results with spina bifida is an incomplete closure of the spinal nerves. So we see a bulging forth in the lumbar spine of literally the spinal cord here and the spinal cord here. This is the most severe of the 3. Here we just have a small little bulging or incomplete union. People that have spina bifida occulta meaning hidden, oftentimes don't even know it till they have an x-ray performed and the doctor said, oh, by the way, you have a small case of spina bifida. They have no herniation of the spinal cord, and they usually have very little residual implications in their life. Somebody with the second form of spina bifida has meningocele. Remember, the meninges are those 3 layers of coverings of the spine and the brain, and they actually bulge forth or have a herniation. This person is going to have mobility issues and may even be confined to a wheelchair. Sometimes they can go in and repair the meningocele, and sometimes they can't. Here's the spina bifida cystica with a myelomyingocele. Myelo is the combining form for the spinal cord. So the spinal cord is fully bulging forward. This person will have paralysis in their life from this condition. It's a very severe form. It's a birth defect. The neural tube develops around the 5th week in gestation, and a lot of babies develop these neural tube defects that early along in the pregnancy, so they're born with the diagnosis of spina bifida. Here's the picture at the bottom in B. This is a child that has the severest form of spina bifida. This child will probably never be able to walk or not be confined to a wheelchair. This is an example, if you follow along with the textbook, on page 364 of what the brain looks like when somebody has Alzheimer's disease. Alzheimer's disease is a brain disorder marked by gradual and progressive mental deterioration. What actually happens is, notice the enlargement of the ventricles that flow the cerebral spinal fluid. They enlarge, but the actual brain mass shrinks in size. Look at the difference between a normal brain and somebody with an Alzheimer base. And look at the gap in the memory. You can see why it's a condition that causes such severe memory loss. It's a progressive condition, and it can span the course of 10 years, but with each passing year, the memory loss gets greater and greater, and oftentimes people realize they have Alzheimer or something's not quite right. They will go somewhere that they typically go all the time and all of a sudden not remember how to get back home. And that may happen a few times to them. Normal degeneration, as we spoke about in class, is about 1% per year. With Alzheimer, you have a gross acceleration of this condition. Alzheimer is an eponym, and it's named after the person who discovered it or first classified as it. The only way to confirm it is after or post-mortem, after death, with an autopsy of the brain. Here's an example of somebody who is suffering from multiple sclerosis, where they have the destruction of the myelin sheath that covers the neurons of the brain. The myelin sheath covers the axon of the neuron. And what happens with multiple sclerosis, it's an autoimmune condition where the body seeks to destroy something that is healthy. And in this case, it tries to destroy that fatty padding that protects the individual neurons, particularly motor neurons. So eventually with MS, movement is greatly compromised. This is an example of somebody who has contracted Bell palsy. If you notice, the picture A shows a different presentation than one side of the face versus the other, and this is the same person without the condition. It is a virus that usually attacks the 7th cranial nerve. Remember the cranial nerves that make up the peripheral nervous system. And what ends up happening is the person wakes up with the eye drooping, the face drooping, the smile is crooked, and if it affects the 7th cranial nerve, oftentimes it takes months to recover. It has no age group. Anybody can have Bell palsy. Some people, even after months of recovery, still have a weakness on the one side of the face where the nerve was attacked. This is an example of somebody suffering from Parkinson disease. Parkinson disease is the degeneration of the motor neurons in the basal ganglia, usually occurring with later onset of 60 or plus, but some people do, like Michael J. Fox, have an early onset of Parkinson, which is more rare than a later onset. But you'll notice all of the motor neurons, with the progression of the disease, they're all affected. Bradykinesia, kinesia means movement, brady becomes a slow movement. There tends to be tremors of the hands, the elbows are flexed, they have a stoop posture, and even the head and face has a tremor-like appearance to it. This diagram is showing us a brain scan when we're looking for a brain tumor. You can see in this diagram somebody has been diagnosed with a brain tumor. One of the more severe tumors to have of the brain is a glioblastoma. It seems to spread very rapidly and often is very hard to treat, even with chemotherapy and operations that may be trying to remove the tumor. It's not the most easiest type of treatment when somebody has a brain tumor that involves a glioblastoma. This is an example, again on page 369 in your textbook. We were talking about a cerebral vascular accident when somebody has a stroke. This, you see, is literally what happens with a stroke is you have a hemorrhage that occurs somewhere in the cerebrum most often. In this case, this is where the blood vessel is so weak or under so much pressure that it ruptures, and now you have a hemorrhage, which means there's no blood supply getting to the area beyond the hemorrhage. Another leading cause of a stroke is where somebody has a buildup of a blood clot, an embolism, where it travels and situates itself in a blood vessel, and eventually that blood clot is so large that it causes the hemorrhaging to occur. That's one of the reasons why they try to put people on medications to reduce clot formation or blood thinners, or they put them on medication that break down the cholesterol, because most clots or blockages of a blood vessel occur because of a cholesterol or plaque-like buildup. This is what's happening when somebody has an aneurysm. When you have a cerebral aneurysm, that means there's one part of the blood vessel, and people are born with aneurysms. And what happens with an aneurysm, it's a local weakness of a blood vessel. And sometimes it will never rupture, and sometimes it ruptures unexpectedly. And when it does, it's a massive bleed out. Oftentimes people do not survive aneurysms when they rupture because it's a massive bleed out. This is just a diagram that you will find on page 372 of your textbook, and it's a normal brain of somebody on the A side, and the B side is a scan of what somebody's brain will look like as Alzheimer's disease progresses.